Hello everyone. Very few questions are important in neuroanatomy for MBBS first year. So this is one of them. So the internal structure of medulla. So we have to cut sections of medulla at different levels, and I am going to teach you about that. So for that you have to see first what is the external structure of the medulla. So this is the medulla. This whole area is medulla. You can see this is pontomedullary junction. So from lower border of pons, medulla starts till the first cervical nerve takes its exit. So this area will be the medulla. You can see this area is pyramid and this is olive, and you can see the anteromedian fissure which is being obliterated by crossing of corticospinal fibers. Now you can see between the pyramid and olive there is a sulcus through which the rootlets of 12th cranial nerve are seen coming, and after olive you will see the inferior cerebellar peduncle. So there is a sulcus between olive and inferior cerebellar peduncle. The inferior cerebellar peduncle is basically connecting cerebellum to medulla. So from that sulcus you will see 9th, 10th and 11th cranial nerves coming out. So rootlets and the nerve are coming out. So that is also known as retroolivary sulcus, the sulcus between the olive and inferior cerebellar peduncle. Now you will see in posterior surface this area is of fourth ventricle, and a central canal is lying within the medulla, and as soon as it comes at this level obex, and it suddenly expands and is part of fourth ventricle. So this is the floor of fourth ventricle. This lower part is included in a open part of medulla. So posteriorly we see what features. This is gracile, the fasciculus gracilis, this is fasciculus cuneatus, and this area is inferior cerebellar peduncle. Now if you see the internal structure of medulla, we can compare it with the spinal cord. Here you see in spinal cord the gray matter is in form of a butterfly or S shape, but in medulla you will see the gray matter is broken into pieces, and these are the nuclei which are separated by moving nerve fibers here and there. So this is main difference. Here the gray matter is broken into nuclei separated by nerve fibers. So we are going to see the transverse sections majorly at three levels: the pyramid, the medial lemnisci and the olive. So pyramid, it can be asked as great motor decussation, or the question can come draw a well-labeled diagram at sensory decussation or at the level of olive. So last one is not generally asked. Only difference between the olive at the level of olive and this, here you will see the cochlear nucleus very prominently, and here you will see the vestibular nucleus, here you will see the cochlear nucleus prominently. This is the only difference. Now here we see the transverse section, closed part of medulla, levels of pyramid, that is the great motor decussation. Please remember these terms because these are quite frequently asked in diagrams. So you all must be knowing these are the fibers of corticospinal tract, and here you see 80% fibers cross at the lower part of the medulla. This is the crossing fibers, and they are ending at lateral corticospinal tract, and here you see the uncrossed fibers are going to form anterior corticospinal tract, and you have seen it in spinal cord. So here in medulla we are going to see section at this level. So here if we talk about, yes, this was the area from where we are taking the section. Just use this pen. Yeah, here you see this obliterated area. Here the fibers are crossing like this, and here is the level where we are taking this section. Now in this section what do you expect to see? The shape is similar to the spinal cord. Here you see here the anterior median sulcus, anterior median fissure, the posterior median sulcus. This area is raised because of the presence of nucleus gracilis. This area is raised because of the presence of nucleus cuneatus. And you see the gray matter is not in form of a butterfly, it has become more broken. You can see here the white matter is coming, the fibers are coming, so the gray matter is like this is nucleus gracilis. You have to draw nucleus cuneatus, and then you will draw one more nucleus. This is the spinal nucleus and tract. Basically this is the substantia gelatinosa के जो fibers थे, वहाँ से जो fibers relay हो रहे थे, उसके बाद जो fibers ascend करके जा रहे होंगे face का sensation लेकर के. So these are the spinal tract fibers, and this is the spinal nucleus. Basically ये trigeminal nerve से related है और face के sensations carry करते हैं. So here you see these are the fibers ऊपर descend करते हुए fibers आएंगे and they will move backward and laterally here, the crossing fibers, and from this also. So this is the area of pyramidal decussation, and this is the area, this is the lateral corticospinal tract, and here is the pyramid. This area is basically anterior corticospinal tract. Now do you see what do you see in white matter? This is the ventral and dorsal spinocerebellar tracts, and there are a few fibers which can be seen everywhere at the level of medulla, diffuse zone, and the networks of the fibers here. This is the reticular formation. And one thing you are able to see is this is the detached anterior horn. This portion has been detached because of the passing of the fiber. Now what will this detached fiber do? This detached anterior horn divides to form spinal nucleus of accessory nerve and supraspinal nucleus of first cervical nerve. So you can see here, this is your spinal accessory nerve ka spinal part, and this is going to supply the trapezius and the sternocleidomastoid, and from where it is arising here, and the nucleus is between present in medulla, and this is the area where C1 is emergent. So this is the area we have taken the section. So C1, part of the nuclei of C1 is in anterior horn, and the spinal nucleus of spinal accessory nerve is in anterior horn. So detached part of anterior horn and representing spinal nucleus of accessory nerve and supraspinous nucleus of first cervical nerve. Now coming on to the next section, that is the level of sensory decussation. So for that you have to understand the fasciculus gracilis and fasciculus cuneatus. You know, those are the white fibers which are seen in white matter, and in gray matter you see the nucleus gracilis and the nucleus gracilis and nucleus cuneatus. So what happens, this is यहाँ से sensations लेके आ रहे हैं, the sensation of proprioception and all these things, vibration sense, everything is coming here, and the gracilis is basically the lower portion of the body, cuneatus from the upper portion of the body. So these sensations will relay here and will cross on the other side. So these are the internal arcuate fibers and will form a lemnisci, thick bundle of fibers, that is medial lemnisci. They will relay in thalamus and finally in sensory cortex. So how, like we are taking a section at this place, basically इस साइड के फाइबर जब इधर जा रहे हैं और यहाँ के न्यूक्लियस के फाइबर जब इधर जा रहे होंगे, तो इस डिकसेशन के लेवल पर हम एक सेक्शन ले रहे हैं. सो दिस इज द डिकसेशन वी आर एबल टू सी, एंड यू विल सी दिस ब्यूटीफुल ग्रे मैटर इज सीन हियर, एंड एट दिस लेवल द 12th nucleus, that is the hypoglossal or the dorsal nucleus of vagus, can be seen, and the nucleus tractus solitarius, so basically the 7th, 9th and 10th nerve nuclei, and these are the for 10 taste sensation. So this nuclei, part of this nuclei you can see here. So this is the central canal. So first you will draw this. Now you will draw a shape like this protrusion is for pyramid. Now this raised area is for nucleus cuneatus, this raised area is for nucleus gracilis, and similarly you can see जो pseudo unipolar fibers, central fibers आ रहे थे वो यहाँ relay कर रहे थे, and these fibers are coming and crossing. These are the internal arcuate fibers which we have seen earlier, and इस side के दोनों nuclei के fibers क्रॉस करके यहाँ पर मीडियल लेमिनिस्कस बना रहे हैं और दिस साइड के यहाँ पर, तो दोनों के दोनों क्रॉस होने के बाद, तो दिस इज द एरिया ऑफ सेंसरी डिकसेशन. नाउ हियर यू विल सी द मीडियल लॉन्गिट्यूडनल बंडल. द टू कॉमन थिंग्स व्हिच यू आर एबल टू सी ऑन दिस लेवल आल्सो, दिस इज द स्पाइनोसेरेबेलर ट्रैक्ट, दिस इज एंटीरियर और वेंट्रल, दिस इज पोस्टीरियर और डॉर्सल. द लेटरल स्पाइनोथैलेमिक ट्रैक्ट also can be seen, the reticular formation can be seen, part of olive also can be seen here. Okay, so this is the sensory decussation or middle of the medulla. Now the third and the last section is at the level of olive or the open part of the medulla. So what do we do? From where we are taking the section? The section is being taken from this level. So this is the area of olive, number 3 is olive, and we are passing a section like this, and this section is passing anteriorly from the olive, and posteriorly you see here the central canal is open at the level of fourth ventricle. So ये यहाँ से pass कर रही है. तो fourth ventricle में you will see this raised area is because of 12th nerve nuclei. Here you will see the vagus के लिए है. So all these nerve nuclei you are willing to see in this section. So you see this is the area of 4th ventricle. So this is the area of 4th ventricle का floor दिखाई दे रहा है, उसका lower part. This basically triangular area, this triangular area. Yes, you are able to see here. Now what nuclei you expect here? This is the dorsal vagus nucleus of vagus. Here this is the nucleus tractus solitarius, that is 7, 9 and 10. So 10th का part यहाँ पर है, and this is nucleus ambiguous. Basically this is 9 and 10 and 11. So basically जो 10th का पार्ट है वो यहाँ पर, जो इनमें 10th वाला एरिया है वो यहाँ पर ओरिजिन कर रहा है. So this is basically your 10th nerve. So how it is exiting, you can see here it is exiting from here. You have seen inferior cerebellar peduncle और olive के बीच से निकल रही थी, तो ये nerve यहाँ से निकल कर आ रही है. Now one more nucleus which we earlier have seen, this is the spinal nucleus and tract of trigeminal. So यहाँ nucleus cuneatus और gracilis clearly नहीं दिखाई दे रहा है. Now here you will see this area, this is the inferior cerebellar peduncle. So this is the inferior cerebellar peduncle. This is the common posterior spinocerebellar and anterior spinocerebellar tract. This is the lateral spinothalamic tract, and these purple things are basically the inferior olivary complex. Here you can see the inferior olivary nucleus, the medial accessory olivary nucleus, the dorsal accessory olivary nucleus. Now here this is the medial longitudinal fasciculus, medial lemniscus. One is medial longitudinal fasciculus, and this is tectospinal tract. So you have to practice these diagrams, these are very important. And here you can see the pyramidal tract, and anterior to it is the articulate nucleus. So this was the third section. Now you see the blood supply of the medulla. If you see the blood, there are arteries which are supplying medulla. These are the two vertebral arteries, anterior artery, posterior spinal artery. So here you can see this is one vertebral, this is another vertebral, and you can see this artery coming here is anterior spinal artery, and it is supplying medial portion of the medulla. And here in this area, this pica is seen coming from vertebral artery, and pica से ही जो posterior spinal artery निकल रही है. So pica ऊपर है और इससे ये posterior spinal artery निकल के आ रही है. So what happens, अगर posterior inferior cerebellar artery पर damage हो जाए, या anterior spinal artery पर damage हो जाए, या block हो जाए ये arteries, then what will happen? The blood supply of medulla in medial portion, that is medial portion will be hampered, and this will lead into medial medullary syndrome. So this is your medial medullary syndrome or Decussation syndrome, because of blockage of anterior spinal artery and because of blockage of posterior inferior cerebellar artery, lateral medullary syndrome or Wallenberg syndrome. Short notes are asked on Wallenberg syndrome and Decussation syndrome. Pseudobulbar palsy is because of bilateral corticonuclear fiber damage and paralysis of muscles of tongue, pharynx, lip, palate due to infarction, and syringomyelia, which is cystic lesion around central canal. This is syringomyelia, and raised intracranial tension. All these things can lead to pseudobulbar palsy, and if the damage in the lower medulla, the death can happen because there is a vasomotor center, the respiratory and the cardiac centers are present here, basically respiratory center. Now the lateral medullary syndrome and medial medullary syndrome in detail. So here is the area which has been damaged because of reduced supply or blockage of the posterior inferior cerebellar artery. So what are these things? This number one is dorsal nucleus of vagus, you have already seen, and this area is basically the nucleus tractus solitarius, and this is your vestibular nucleus, and this is your spinal tract and nucleus. This is tract, this is nucleus, the descending sympathetic tract, and this is your nucleus ambiguous, the 10th का एक nucleus है इसमें भी, and lateral spinothalamic tract. So what will happen if there is trauma on this area? So lateral spinothalamic tract will be affected, so there will be contralateral loss of pain and temperature. Nucleus ambiguous is basically supplying the palate, pharynx and larynx. So there will be ipsilateral loss of action of the muscles of soft palate, pharynx and larynx because of nucleus ambiguous, and descending sympathetic tract is going to lead into basically Horner syndrome, comprising of ptosis, ophthalmos, meiosis and anhidrosis. And if the damage is on this spinal tract and spinal nucleus, so ipsilateral loss of sensation of face के sensations carry नहीं होंगे, so there will be loss of pain and temperature on the same side of the face, and because of spinal nucleus and spinal tract. What would happen if there is damage at the level of in this area? This inferior cerebellar peduncle is affected, so the spinocerebellar tract and part of cerebellum results in loss of equilibrium, that is ataxia of limb you will see in this patient, and vestibular nucleus damage will lead to giddiness. And I think most of the things we have covered, so you should learn all these clinical features. If you know the different nuclei, then you will be able to explain all these. So here you see in midline, because of damage to anterior spinal artery, this area will be infarcted, there will be damage to this area of medulla. So because the pyramids are also being damaged, so there will be contralateral paralysis of the body, and this 12th cranial nerve is also being affected, so there will be paralysis of muscles of tongue on the same side due to injury of 12th cranial nerve. And in here you can see this area, this was your this is medial lemniscus, and this is medial longitudinal bundle, and this is tectospinal tract. So all these things are going to get affected. So because of because of that this medial lemniscus injury, there will be loss of sense of vibration and position. So medial lemniscus damage will lead to loss of sense of vibration and position. Now tongue muscles have been affected. So everything we have seen. Thank you for watching.